wherein I can generate a lot of personalized content based on student performance, give it different levels of the Bloom's taxonomy in terms of the higher levels of cognitive thinking, and then accordingly, create content that is very suitable for my students. And I'm going to go through one more slide before we can take a pause and go over if anybody has any questions. But I want to cover overall the use of AI. And in my mind, I break it down into three parts. One is diagnostics. And so this is a study, this McKinney is a study from a large data set actually from UK and US. So what they did is that they took 6 radiologists, looked at mammograms of over 3,000 women from the US and more than 25,000 women from the UK. And they all were looking at, the breast cancer, different stages. And so what happened is that this same data set, these images from all of these women, these mammograms were taken and it was shown to a AI tool. And there was a reduction of false positives, about 5.7% reduction in false positives, and a 9.4 reduction in false negatives based on the AI screening of these mammogramic scans. So you can imagine that in terms of just effectiveness and time saving as well as cost saving, this is huge. The second study that I wanted to highlight was this study from Esteva. They trained a computer neural network and they used a data set of about 129,000 clinical images. So this consisted of more than 2,000 different kinds of diseases, all based on the skin. And there were 21 board-certified dermatologists who had looked at this data. And then this neural network was given this data set. And it was basically told that, we want to look at keratinocyte carcinomas, which is one of the more common ones. And then we want to look at malignant melanomas, which is one of the more deadly versions. And we want to see, what the AI tool can do. And this tool was able to achieve 88%, was able to achieve absolute performance on par with the dermatologist, and really kind of demonstrating that the capacity of classifying skin cancers, which is not very, very straightforward, with a level of competence that is comparable to dermatologists, is supreme. The second part of the use of AI in the medical aspect that I think is personalized medicine. So AI's potential to personalize treatment plans is just transformative. Learning from a patient's progress, adapting in real time. So this study by Wang, they were looking at actually autism screening, and there are just standard autism screening tools that are used, and then they use this neural-based diagnostic classifier. And they saw a 13% improvement in terms of the classification compared to the standard autism screening tools. So this could also be considered a strong way in which we can use this in our clinics. And the third, which I think is just absolutely phenomenal, the growth and the potential is AI-powered apps and devices. There are so many that you can, I'm sure if I open it up to the audience, there'll be so many different types of tools and apps that you have used. One that I found really interesting was actually related to more of the mental processes. So this was a study by Prochaska where they conducted a study with 100 different patients, and they were looking at substance abuse. They were looking at whether there were cravings or depression. And then they created this Wobot, which is a mental health digital platform that was built upon AI. And along with the regular, they gave a control, the test, whatever their evaluations is. They used this for these 100 patients, and they saw that this Wobot was able to deliver tailored content, which allowed to a significant improvement in depression and anxiety, in substance use, in craving. And by no means is this, this is just like a very small snapshot of all of the different tools that are possible. I've been reading about different tools for just, devices which you can use to screen for pap smears, for biopsies, for mammograms in rural settings. I've actually been looking at some of that too. So AI has an absolutely expanding role. And if the moderators want to go ahead and take a second and see if there's any chat questions, I'm happy to take a
I
second.
think we can continue, Rohini, and we can take more discussions after you go on. Please continue.
Perfect. Okay. So definitely there's an expanding role. There is, I mean, if we were to predict the future, I'm not sure we could really predict in the number of ways in which we are going to be seeing AI working in our lives, in our daily lives. But this also brings, some concern to us. Like, when I talk to some of my students or the medical student, they'll be like, I mean, I don't believe it, or I'm not sure, will my job be replaced? What do I do? So to that, I think of this, our challenges globally as we forge ahead. So the WHO estimates a shortage of 11 million health workers by 2030. And this is going to be primarily in low and middle income countries. This will be exacerbated by, the difficulties in education, the employment, deployment retention, as well as the performance of health workers. I know I recently finished a research study in the slums of outskirts of the city of Banaras, and we were working on a vaccination intervention for caregivers of children from 0 to 2 years of age. And so when we introduced our intervention, we were working very closely with the community health workers there, a lot of the Ashas and the Anganwadi workers. And anytime I talked to the Asha lady, she would be like, I have to go to 2,000, like in her roster, she had to go to 2,000 homes. And when we looked at the demographic sampling of our population, this study had 3,000 participants. Each house had a minimum of, like, the average was 9 people living in that house. So in a month, and of course, leave the weekend along and aside, but 5 days, the Asha Didi is covering 2,000 homes, expected to be making notes of everything, expected to be coming for all the trainings, and then really work with all of these people individually in each of these homes, which is it's just mind-boggling how it all happens. So there's definitely lots of challenges ahead and ways in which we can incorporate AI. There's also underinvestment in education and training from the LMICs. There is a lot of international migration of health workers that contributes to these challenges and ongoing shortages. So it's something that if we haven't already, we should be considering looking at this and seeing how we can move ahead with the use of AI. So I know I said that I'll touch base on some of the best practices in the use of AI. And this is a quote from Alvin Toffler that I really like. And I know that as I was looking at the Marvelous Medicine podcast, the past ones, I know one thing that really shot out was that everybody is in that mode of zone of learning and wanting to, see how we can best move ahead. So this is an example of a bad prompt. You tell AI, I'm hungry. And what is AI doing? It's basically generating responses based on what you've put in. And so the response is, Sydney, here's a whole bunch of useless text because I don't know what you want from me. I cannot read your mind, but all I'm doing is generating data from the prompts. Okay. An example of a good prompt when we're using AI would be, I'm an adult man. I'm weighing 200 pounds. My daily caloric requirement is 2,500. And then I want to hit my protein goal, which is 120 grams. And I'm hungry for something hot. And I want something a little salty. And the perfect answer, scramble and cook 4 eggs, right? So, but my point with sharing this with you is that it's really important as we used AI that we're extremely mindful in how we're asking because it really helps in the output. And for this, I use this 6-step prompt checklist. So the first is that you want to clearly define your task. What's your end goal? And I've also put up here, like, which one is more important versus less. And then the second is you want to tailor the context. Like, what is the context where I am? What is it that I want? Provide some examples. Okay, I'm looking for a table, or I'm looking for, this kind of a structure or style, and this is the reason why. Explain your persona. So this is kind of, and I'm going to show you an example of how I do it. But you're kind of telling AI how they should think. Like, what do you want them to think like? Do you want them to think like maybe a chef? Do you want them to think like a gastroenterologist? Sorry. And then finally, the last two important things are the format, because you don't want to go back and forth with like, okay, this is what I want, but you don't get your appropriate format. And then finally, the tone. And this is fun. So I have a mnemonic for this because this is a lot of steps. So the clever educator provides focused teaching. And I've also actually shared this with my students. Some love it, some just, don't want to talk about AI at all. So I wanted to share an example with you of how I do this. So let's say I want to create, the task is that I'm developing GI system-based assessment for medical students. I want to focus on basic foundational knowledge, but I also want to add some clinical application and program solving skills. The next that would be the context, in that this is designed for med students. I want to make it challenging, but I also want to apply it to real world clinical practice. Okay. Then just examples. So for example, I want case-based questions. I want maybe clinical vignettes, problem-solving scenarios. And I also tell them that I want to assess knowledge application not only, but also move beyond that rote memorization to see how they're applying this. I tell them that I'm a highly distinguished medical educator with decades of experience in medical education, curriculum design, and then assessment methodologies. The format. So I want multiple choice questions. I want one that has a single best answer format. I want, you could include some image-based questions. And then finally, the tone. So I tell them that the assessment should be rigorous but supportive. It should encourage some deep thinking and clinical reasoning. And the goal is that to ensure that the students grasp both the theoretical knowledge, but also the practical application. So anytime I'm using any of these artificial intelligence tools, this is kind of the format that I use. And it's been I have had a lot of medical students come and tell me that this has really helped them with their learning process. This has helped them to tailor their own questions about things. They put this in question form and they get a lot of content that's been generated. And I know that a lot of the educators are also using this kind of format. Okay. In terms of the use of AI in research, there's a lot that can be done in terms of data analysis, just even the literature review portion, which can be really tedious. So a lot of this has become much easier and allowed that deeper thinking and analysis to go on.
We could take a bit of a pause here and open for the discussions of so far what we have covered is the utility of AI and then some challenges of utilizing AI. We will come to the more hot topic of ethical considerations in a short while. So what we could open up the discussion is for how do we see the utility of AI in our practice? Essentially, there are three sort of areas I look at, Rohini, is that, look, it helps in efficiency, and efficiency in many ways. Two, it goes into precision, where, the precision that we didn't have because of the inability to bring information from multiple places, now it is able to bring in. The third area is the personalization that it is able to do nowadays. So I think while we all, as traditional clinicians, have some sort of cynicism towards the role of AI, uh, AI, when used in its real sense and for its real purpose, brings a lot of value. So it's up to us at this point in time where we make value. But it is not very far away where AI starts becoming a much more powerful agent. So today, much of the topics that you covered, what we call as narrow AI. Narrow AI is AI which is focused on specific tasks, and those tasks are assigned by you as human, and those tasks that they are able to do. But already the world is going into what you refer to as generalized AGI or generalized AI, where the AI is already starting to reason and reproduce on its own. So the reproducibility of the AI has become a much more challenging issue for humans, because the moment AI starts reproducing, it has the ability to generate on its own. And someone had asked in the chat about, what about emotional? It's not very far away. In fact, there are a lot of philosophy-based AI questions and AI applications where they are saying AI is having much more emotional quotient than human emotional quotient. So, in the days where we are having the integration between robotics and AI, what we call as AI embodiment, that is basically we are saying that AI is becoming human-like, literally human-like, not in just thinking or reasoning, but also in behavior. So there is a whole field of moral AI which has started evolving now, where we are started thinking about the consciousness of AI. So I think it is not, I mean, the pace at which AI is growing today is so rapid that we cannot leave this behind. We need to embrace it, we need to be able to control it, and we need to be able to use it appropriately. And stark reality that we all have to face, rather than be counter sort of argumentative about it. The challenge is, like a nuclear reaction, it has been started. So there is no way that you can stop this nuclear reaction. You could possibly bring in the various control mechanisms into it. We just have to wait and see how it goes. So fantastic discussion so far on how and where AI is being utilized in healthcare. Vivek, any thoughts from your side before we look at a few questions from the audience?
Yes, like Dr. Shivam has told right now, the question is like till date, humans are controlling the AI. Like we are able to monitor, we are able to look after the AI, but slowly or maybe in short time, when the AI starts controlling the human, then that is the challenge now we may face in the future. The second is like the good thing about AI is at this moment, even in learning, we are able to personalize the learning environment for the students so that the AI can generate the content based on the requirement, or maybe the cognitive function of the students, or maybe the grabbing capacity of the students. And even in that, it goes the same with the personalized medicine. But AI should be a tool to assist us for the diagnosis, treatment, and in any other profession as well. The question is again, this is a topic that goes on discussions, and we still have several questions. Can AI control the humans, or human is controlling the AI? These are the two questions that again that comes to us. Recently, I had attended an event in Malaysia. It was related to AI, and there was a presenter who was presenting regarding the pros and cons of AI. She was telling every detail in such a beautiful way, and at the end, we didn't know that she told us that the PowerPoint which I had created, it was all AI generated. So we came to know at the end that that PowerPoint was AI generated. So AI, it has a wide scope, and definitely in medicine, the question again comes like the emotional integration in AI, or maybe logical thinking. These are the questions that definitely need some time to release the solutions on that. So over to you, Dr. Shivam.
Thank you. I think there has been a question about the utilization of AI in pathology. Dr. Radha, we'll come back to your question on the legality, which will be covered possibly in this next part of the discussion. Prashant has asked a question on, what is the role of AI in pathology with minimum investment? Any reflection there, Rohini? And so I think I can answer a bit about that because I'm doing some work recently on AI in digital pathology. There are 2 or 3 very big areas where digital pathology has just taken off in a big way. The first thing is what we call as automated diagnostic reading of AI. So what is happening is as pathology is being digitized, it is now amenable for automatic decision making by looking at what we call as computer vision. So computer vision is almost like reproducing your microscope and your eye, and there is the whole reasoning behind that whole vision that has been come up through these slides. So digital pathology is become very real, and it is also becoming very automated now, particularly in areas like cytology. So we are working with an India-based company, in fact, recently on how cervical cytology, cervical smears can be automatically read. So, the high volumes that are one of the challenges that pathology faces is the volumes. And overall, the manpower in pathology is rapidly decreasing around the world. So AI helps in bridging that gap between the gap in manpower and at the same time increasing volumes in the need for pathology. Rohini, you had anything to add to that?
No, I absolutely agree. And we've also been looking at a couple of different products that help in doing these diagnostic testing in pathology labs. And there was one question that I had read in the chat, and I don't remember seeing it now, but talking about that the downside of using AI apps. So a lot of times what happens, and I think I'm also going to cover this in the ethical considerations, but a lot of times what ends up happening is that there may be, because these AI tools are trained based on the training data set, there may be a lot of biases that come in through that. And so having that cultural knowledge, which is also wise, setting these parameters through which AI can really learn and use the data set is extremely important. But so most of the research studies that I look at, they are always ones in which the good ones are ones in which the data set has been deployed. And so they're using a particular data set. So I think that is something that we should really be focusing on, that we're using things that are relevant in our sphere so that the outputs that are generated make the most sense to the population.
Can I add something?
Ravi, you had a question.
Digital pathology?
Yeah,
Ravi? Yes. Yeah. Thank you. So while digital pathology, I think acceptance is increasing in diagnostic studies, as a research application, it hasn't yet been approved by many agencies. For example, in the field of, say, MASH, agencies do not accept using a digital pathology scored slides for meeting inclusion criteria or even determining treatment effect at the end of the study. So we're still using humans to read these slides, and there's been a lot of studies, publications that show that digital pathology may be better. But again, it's really hard to tell whether that amount of precision is necessary or is the human kind of assessment sufficient. So that's point number one. Point number two is not all digital images are equal. So again, the equipment that is used to digitize slides has also needs to be approved by regulatory authorities, whether it be for diagnostic use or for research use. So there's a lot of things involved here that need to be ironed out. But yes, digital pathology is, getting up there. And there are, for example, there are companies like Path AI, et cetera, in the United States that are really going after the AI part of pathology.
Thank you. Ilango, you had raised your hand. Any questions, Ilango?
I just wanted to share what I felt with images. So I've been preparing these contents for MBBS training in the last 3-4 months, and I usually try to use the digitized image from various websites, from pathological websites, and those that are shared on the web. And I try to see whether the ChatGPT is able to read that. But at least for general use, it is not there. How do you think the pathology? How do you think the pathology artificial intelligence is working? Is it because of the training subset? To add to this, what I would also tell is, it is recently the program has become very good in recognizing medical algorithms. It still writes shoddy algorithms, but if I give a prompt and I put the restrictions, the algorithms for routine patient management is very, very good. I was recently in Northeast India, and I was seeing a lot of alcoholic hepatitis patients, and in the evening, I just wanted to write a program, and the O1 Mini gave me a program to assess a patient with alcoholic hepatitis and to write a proper prescription on my prompt within about 15 minutes. And I could run a clinic knowing very little about the management of a completely different problem, which a surgeon need not be aware of, and then provide an appropriate medical advice. So the algorithm writing is good, but the image reading of general AI software that is available to the public, what at least practitioners like me are have access to, are still way off. I think what I have seen with use of artificial intelligence is mainly with blood smears. They've become very good at reading blood smears, but not with regard to pathology. I think still that needs a human input. That's my thought process. Anything on this from Dr. Rohini?
Thank you.
Absolutely, I agree. The one is that, of course, the training data sets, and then two is that it's learning as we give it more information, which means that, it's extremely important to have that human in the loop. We cannot just rely completely on AI and what the outputs that it generates. So we definitely have to be extremely cognizant of those factors as we move forward. And I've also been reading a lot about I think one of the chats was talking about the amount of energy that is expended in even just a single, simple prompt. It is mind-boggling. So, like with anything else, when giving great knowledge, it comes with a lot of responsibility. And I think that that's also one of the reasons why we're having a lot of these conversations, is that we can really educate folks and see what are the best ways to move forward using this technology. So absolutely with you on that.
I think one of the things we have to realize is that the AI that we are seeing out in the market is very early AI, actually. The AI which is in the research and which is already in industry is far ahead, and it's not yet been released for common use. So the AI that we see in chat GPTs and other types of AIs is something what we call as narrow AI, and they are actually conversational AIs. So effectively what they do is they work on algorithms, yes, no, yes, no, yes, no, and okay, that's the way it works. But what's happening is there is an AI which is general AI where reasoning comes into place. So nowadays they're programming AI not to respond in microseconds or milliseconds or just in 1 second. They're taking the time, like how humans take time to think about an answer and question and bring tens and thousands of your past memories and resources into play before you give an answer. So reasoning is starting to come in place, and that reasoning is not happening just in few seconds or few minutes. Now they are training the AI to think over days. and even over years now. So what they're saying is ultimately when you have super AI, which is AI, which, see, if you look at agentic AI or if you look at any narrow AI, that is just going to task-based answers. When you're coming into general AI, it is not one task, it is bringing multiple tasks together. So it can answer an answer that an organization takes time to answer. So supposing we are developing policies for antibiotic usage in surgery, then we bring surgery department, we bring the pharmacy department, we bring some medical legal department, we bring 5 or 10 departments together to do that work. But that is what a general AI possibly can do, where it brings or synthesizes knowledge by bringing multiple different sources together and think and as well as reason out. Now, what they're saying super AI or superhuman AI is going to do is not just bringing across organizations, but it's going to look at not organizations over a period of time. Imagine Jipmer had the ability to bring the education and the wisdom over 50 years together and then synthesize an answer for a problem which not only will have knowledge or IQ or information, but also has wisdom added to it. So we are moving from that phase of just being reactionary answers to synthesized answers to well-reasoned answers, and then now over to the field of wisdom coming into place. And that's where the whole fear is. And possibly, Rohini, in your next section, we will be covering those things about, where is AI taking us over and where is it entering into this realm of becoming more human-like. The whole issue about it is, you were talking about content generation. Today, the content generation has become so perfect that it is indistinguishable from human. Like someone said, a PPT made by the PowerPoint by a doctor or by the machine. No one can. In fact, the one made by the machine far exceeds human-generated content now. The same thing will soon happen in machine-generated reasoning. We're not talking of just content, we're talking of reasoning. And that is where some of the questions in the chat is about, is human, can they replace our emotional thinking? Can they replace our ability to think beyond just the facts? And that's where it is going. And we have to be ready for that. So while I think we have got mindful of the time, let's go into the second half of this discussion. There's going to be much more, I think, challenging for you, Rohini, to bring in the ethics and the issues that humanity faces with growing AI.
Absolutely. And I mean, we've touched on already a lot of things that are going on in my mind constantly as I'm using AI, as my students are using AI and looking at things. So in terms of ethics, there's just so much to consider. And, prior to this, I wanted to see, and if you could respond in the chat where, have you thought, prior to our conversation today, but have you thought about the ethical issues with the use of AI? So 1, if you could respond to say yes, but it's not in my control. 2 is yes, but I really don't know what to do. And then 3 is like, not really thought of it. Right, so I see lots of 1s and 2s, yeses. Yeah, so I think most everybody
Looks
is
like
a
it's
yes.
spread around. Yeah, yes.
It's an overwhelming yes. And you see, here's two, I want to share this, which is kind of sad, but so this is from last year, 2024. And if you look up, there are so many now retractions from different journals. So this is from Radiology Case Reports, where they removed an article because there were issues with it, with the a lot of it being generated by AI. Science retracted this because this image was generated by AI and it was completely a bogus image. So there's just so much to think about it. I put it into 4 main things, which is 1 is biases. The second is, of course, the privacy issues that there are. And then we have transparency and accountability. So these are four big, big blocks that I see in this. There has been guidance. It's not like we don't have guidance. There has been guidance from WHO last year. This was published where, and a lot of what I'm going to talk about or in the next few slides is based on this ethics and governance for artificial intelligence. So when we're talking in terms of biases, we're saying that, the AI system could, based on the data set that we're presenting it with, it could amplify existing societal biases, recommend treatment modalities, maybe, for example, that may underperform for minority populations, because typically what ends up happening is that high resource settings or places where there's more money, more data sets are generated from there. And so then you cannot really apply that to a low resource clinic or a low resource setting. So it makes it much harder. There's also we talked about do we just blindly believe what happens? There is an erosion there over time. There may be an erosion of critical thinking skills, as well as risk of perpetuating errors, because we really don't know. When we talk about patients, I think the bigger concern is also privacy, because you're relying heavily on large data sets that can often contain sensitive health information. And while you require these data sets to drive the innovation, it can be unauthorized access, or it could end up sharing misuse of data, for example, for marketing or insurance purposes. And in all honesty, a patient comes to a doctor, they want to talk to somebody who understands what's happening in their body and why they're feeling the way they are. They're not really understanding what the implications are. They don't even know to ask. Even I sometimes don't know to ask. There's also this big lack of transparency. It's, in my mind, I think of it people say data sets, but it's like a black box. I don't know what's happening in there. And often this can, undermine trust in AI-assisted decisions. So it's very important to validate, against the clinical guidelines. And we talked about this right now, where, it becomes very important for us to make sure that we're aligned with clinical guidelines, the local practice guidelines, the regulatory guidelines, whatever is needed to make sure that, we're on the right path. Whatever the output is coming in is what we should be using. And it also encourages a reliance without really understanding, because I don't understand a lot of coding. I've never done coding in my life. So when you tell me that it's using X, Y, and Z, I have to really exert myself and understand what's happening on the back end. And not a lot of people have that kind of bandwidth. Okay. And then lastly is accountability in their outcomes. So there's a lack of clarity. I think somebody mentioned in the chat, who's liable? If there is an error, are there policies that determine it's AI's fault? What does that mean? How are we going to circumvent this? And so it's very, very important to determine in all of this, who is responsible in this big picture. So some practical strategies that I think are useful, that I have been thinking about and talking. And one, of course, is positioning AI as a supportive tool. You're looking at it to enhance. You're looking at, rather than really replace yourself, right? We're also, as AI is coming in, I think it's extremely imperative that we analyze and adapt to the change in roles, the responsibilities that will happen in an organization due to this implementation. So, just how are we able to foster that conceptual understanding and keeping that balance and critical thinking? We're not, just handing off something to a bot, but we want to make sure that we are right there with them. It's really important to facilitate that collaboration between healthcare professionals, between the AI developers, between companies that are creating all of these data sets, between ethicists, right? So that we know that we're on the right track and there is some kind of balance and overseeing of this whole aspect. And then encouraging questions and advocating for transparency. I think that's the biggest thing that I do with my students, with the medical students, is we talk a lot about what does this mean, so that they're questioning and they know, what the future, I don't think anybody knows what the future entails, but they can imagine and understand what that might be coming in. So it's really empowering a lot of that asking questions. So 6 main steps, for which one is the importance of understanding a clinician is verifying these AI assisted decisions. And we talked about that in the pathology. So if you're using a data set, for example, the study that was done with the mammograms, they put in the data set, even with the clinical diagnosis, the skin diagnosis. And they told the system to just use that. So that makes sense. But then you're still walking in, you're looking at what's happening and making sure that it's aligned. Fostering partnerships between all of these legal experts, as well as all of the different facets of a administration. Patient engagement, building trust through informed participation, feedback, and then ensuring compliance, because of all of these companies that has your data, do they have that? Like, don't just, check that box. Make sure that you know what is happening and really why do you want to give your data. And then this, I think, is also very important, where you're prioritizing a diverse and a representative data set so that it can be for that cultural context, because that is very important when we're dealing with a human being. And then finally, create institution-specific policies. I know at GW, we have our own now AI that we're using, that we're supposed to use, so that once you put in a student data, it's not out there, or you put in patient data, it's not out there. I know Hopkins is also doing that, and I know a lot of other institutions, university and research-based institutions are doing that. But I think at the end of the day, finally, we've touched about this, that it comes down to integrating AI into our profession. Let's not lose sight of the fact that as and when these AI tools expand, we have our humility, our compassion, which remain the cornerstones of patient care. Okay, and also, these are some things that just cannot be replaced. Our metacognition, our empathy, our intuition. So, AI is definitely a powerful tool, but it's our humanity that is making healthcare truly effective in that. So that's it for me, but I will stop sharing.
Thank you. Thank you, Rohini, for that really a good ending to the discussion, and we can open that up, I suppose. I think the biggest challenge that we're facing with the evolution of AI is the factor called autonomous AI, right? Where AI is going to take over its own autonomy and its control. And it's already doing in many ways. For example, none of us realize that AI is driving much of our purchasing behavior today. Much of what you read today in your mobile phone is AI driven. Your knowledge is being shaped by AI. What you listen to is being shaped by AI. So to some extent, we have become sort of a victim to the force that we have created. On the other hand, the challenges around ethical regulations has had its own political problems. One group of the world want to be pro-AI, and the pro-AI way of looking at it is let AI run its course and let it bring good to humanity. That's one way of thinking, and which is much the US and capitalist, based economies all think that, look, let's take the maximum benefit out of AI. On the other hand, we got a largely more conservative and more restrictive thinking in the regulatory area, which is Europe, and much of European countries are trying to actually bring in this concept of, let it be a regulated AI rather than free for all AI. It all depends on how we are going to be bringing this environment of self-replication ultimately into control. Once we are having a nation like China, or even if you're going to look at it from Russia, or even any other communist perspective, they have a different ethos towards how the AI has to be used. So we are in a very complex scenario here, and therefore AI is literally a minefield and a place for battle now. It's actually the battle for AI supremacy. And in that battle for AI supremacy, ethics in AI takes a back seat, because ethics is seen as one of the factors which are controlling the growth of AI. And you've already seen the policy with your new Trump and Musk and everyone trying to push things in different directions. So that's one big thing to keep in mind in the ethical evolution of AI. The second area for ethical consideration is the quantum AI, which is much, much different from the way we are thinking today. Today, we are thinking in terms of what we call as 0 and 1 thinking. That is, it is either or thinking. That's the way we treat medicine also very often. But we know that when we treat patients with very complex problems, it's not one scenario, but multiple scenarios that come into picture. And with quantum AI, that is going to become a reality. It's not sequential thought anymore. It's going to become not only parallel, but network thinking, which brings in a big challenge again, right? You're not thinking of a solution for just US. The moment you start thinking of a solution for US, it is already impacting Africa and possibly China and India in that one single decision making. So AI has now opened up the impact of decision making from local to regional to global impacts. And that is a big challenge, again, that we are going to face from an ethical problem. We can open the discussion over to Vivek. Any points from your side before we open to others? Yeah.
I just wanted to add one point regarding the AI in research and journal, maybe publications. If we see the graph of the last few years, the number of paper published globally has risen, like it is more in last few years. And one of the reason is the easy accessible to AI platforms, like one of the common platform is ChatGPT. And here there are many content, the writings are created using AI. But again, there is another side where AI can help us. There are AI software that can help us to tell that this content is 70% AI generated, 90% AI generated. So though that's not accurate, because I was recently working on that part, that's not quite accurate, but it can help us to tell. The question is, can AI be used again to combat the effect done by the AI? But this is like two-way fighting, and it goes on for a long period of time. So we cannot say that. But AI, again, there is a competition between the AI and AI, human AI, followed by the AI and AI. That is the part. And the second part I was just talking about is one of the if we see the most common platform of AI that we are using right now is ChatGPT, and if we give the same, if we had provided the same prompt 2 months back, and right now there is a difference in the quality of outcome that is provided by the AI. So definitely it's rapidly changing the quality, or maybe the outcome is rapidly changing. And if the pace is same, there's again the question of ethics, and again accountability comes in maybe next few months or maybe few years. And there's also difference in the outcome of AI which we are using in common platform, the paid version of AI, whereas the free version of AI, they have a different results. At the same time, as Dr. Shivam has told us, the AI that we are talking about most of the time is the AI that we are using in our daily life, maybe a ChatGPT, but there are much more complex AI mechanisms that the researchers are using for the diagnosis of stroke, Parkinson's, Alzheimer's, and many other diseases in other areas of medical sciences. So this was just my view.
Thank you, Vivek. Maybe we can look at the question Radha posted before, which was around the legality. The question is if there is any discrepancy between physician and machine for diagnosis, whose decision matters most? What is the legality in such a situation? I could start the answer, and maybe Rohini, you could add to it. At the current state of how it stands, legal implications of all medical interventions, whether it is decisions or whether it is treatment, or is currently human held accountability. Till there will be a situation where we are going to have machine read or machine delivered advice, or machine delivered, say for example, we have now the whole of almost a very big field of diabetic retinopathy screening is being digitized and completely led by AI. And AI is able to almost accurately give the risk stratification for diabetic retinopathy. in that scenario, what will happen is we are entering into a phase called co-creation and human-machine collaboration. So there will be a point in time where there has to be a joint accountability. And how can you hold the machine accountable? It will be the creator of the machine who's going to be held accountable, right? So for example, if DeepMind has developed the diabetic retinopathy capability, and an ophthalmologist has used the diabetic retinopathy screening solution, and they take a decision together, and if it goes wrong, then both the ophthalmologist who took the decision as well as the company which developed the AI becomes currently liable. That is the way in the European legal system it works. And therefore, a lot of companies now take a lot of chance. I mean, they're not pushing AI into very complex activities yet, where legal issues are there. That's one way of looking at it. But there are going to be complex issues later on when autonomous AI comes in place, and people are still not sure how to hold autonomous AI accountable. In fact, there is a question asked: does AI have morality? Does AI have morality? Should AI take a moral decision? Say, for example, the moment you have assisted suicide nowadays, and if you have AI-driven decision making and AI-driven machines to deliver assisted suicide, would you make AI morally responsible? So there are a lot of such questions which is evolving now, which are very complex for us to address, and we have to face them in the future. Rohini, any thoughts on that legality issue?
No, absolutely, you're right. It's right now it's the responsibility of the physician, and I think the bigger challenge is that we don't have any concrete answers, or we don't have any, like, okay, this will work. So and it's evolving, it's transforming, it's explosive growth, like Dr. Shivam and Dr. Bebek were mentioning. It's going to start thinking like us. So it's just that we have to figure it out as we go. But I think what the main crux is that having this, in our mind as we are working through this, and being able to accept these changes is because I also see a lot of folks who are like, I don't trust anything AI, so I don't want to, deal with it. But like it was mentioned, everything kind of is almost already AI. So we cannot afford to be just on the byline standing and watching.
So there was one sort of reflection from Vinod, which talked about open sourcing. With open sourcing, regulation is going to be a challenge. I think there is another big ethical dilemma that is happening, particularly in the area of content generation. AI-led content generation is copyright issues. Particularly about musicians and for example, if you look at today, IP in the healthcare field is held by individuals, right? Who invented things, or who brought into place some sort of procedure or drug or something like that. But in the future, we are going to have a mix of human and machine-generated IP. And there, it is a complex area for legal copyright issues. And for example, if you look at AI written textbook, for example, you could have today a very good textbook of anesthesiology or surgery written by AI thing. So who has the copyright on that? It is essentially looked at references from billions and billions and over hundreds of years and pulled it together. And so that there are two challenges in that question. One, like the musicians, they're all complaining and saying that AI should not be let to go free, or the companies that are developing AI should pay them copyright or some royalty. That is one way of looking at it. The other way of looking at it is, guys, if you didn't have this capability of AI, you wouldn't have had this super normal or content which you couldn't have generated before. So live with it and have the benefit of new content rather than cribbing about copyrights. So both sides of the coins are being discussed currently. There's a question Kaushik has asked about AI hallucination. It's a problem. Rohini, you want to talk about AI hallucination for people who are what it refers to is AI creates some sort of wrong concepts, but they are so realistic in nature. So for example, you could have an essay written by AI, which looks absolutely right, and it looks, everything is nice and correct about it, except that conceptually it is wrong. So hallucinations is one of the biggest sort of problems that AI models face. So AI models have a concept called generalizability. Say, for example, in medicine, if one GP says, look, I have treated 10 cases of tuberculosis, so I can treat every case of tuberculosis. That's how we generalize as humans, right? I've done 100 cases, so I can do the 1,000 cases because I know about 100 cases. AI has the ability to do the same. It generalizes. And therefore, ultimately, what happens is it gives some generalization to a concept which is actually hallucinating. So that's a big problem with AI, which is evolving today. Rohini, you want to add, or Vivek, you want to add on that issue of
Definitely.
hallucination that was brought up? Yeah.
Talking about the hallucination, if we see the content, it has improved over time, because when ChatGPT was early in the market, there were more AI hallucinations. But with time, maybe there are more data training going on across the world, and those data training are making the AI, the hallucination, less effective. But again, the question is, there will be an area where AI hallucination is a question for everyone. Like, we cannot blindly trust what is provided in the AI. And if we see the content of the AI, the content created by the AI, as a person, if we go on reading, there are certain terms that get repeated in AI generated content. Like when I do paper review for the journals, I usually find furthermore is common term that is usually created by AI. And not only this word, there are so many other terms that helps us to see, okay, this must be some AI created. Then I check into another software using whether that is AI created or not. Talking about the hallucination, there will always be an area, because again, the question is accountability. Who is accountable? Like, we cannot blindly trust. And Dr. Shivam told, like, the company, maybe later, those who manufacture those softwares and devices, they will be accountable. So maybe this was the way thought.
Thank
Yeah,
you.
I've had I've had AI hallucinate and generate an entire citation, which does not even exist. So yeah, so hallucinations are real, but I think the key for that is to, of course, monitor, but then also be able to use a specific data set or give it the prompt. Like when you're giving the prompt, you tell it. And that's also why I shared the prompt checklist, because you tell it exactly, like I will tell it that from X, Y, and Z chapters, or I will upload, whatever my slides or something, and I'll tell it, can you make this? And then accordingly, that hallucination aspect goes down a little bit more. But if
Citation area that I feel that one of the most common area of AI hallucination, because they randomly cited, I don't know like today what they are doing, but maybe a few months back, when we used to compare with the original citation and maybe AI generated citations, they were randomly citing some articles. So this is one of the area of AI hallucination.
There's a next question on the chat which says, will AI systems make clinicians overly dependent on technology? It's a very interesting question, and it depends on how you define technology. Today, if you ask an anesthetist, who's, I think we could have the debate between Professor Ravi Shankar and possibly a younger anesthetist on the call today. And Professor Ravi Shankar will say, look, I relied so much on my clinical intuition and my ability, my fingertips and my ears and my heart and my head. But if you look at the anesthetists in the ICU today, they're going to possibly say, we look at the 100 graphs and 100 machines which are running there, and possibly both of them will come out and say, we did the best job in the world. But if you look at possibly anesthesia-related mortality, has it decreased over the years or not? That's the question we have to ask. And if outcome has improved because of the use of technology, then there is no doubt that technology has done has been value adding in its nature. Right, and therefore the way I would look at it is you becomes as dependent on technology based on the value that it delivers, and the value that it delivers is based on the outcome that it delivers. For you, as a healthcare practitioner, the outcomes are defined in multiple ways. It's not just whether the patient survived or not, whether the surgery was successful or not. There is a whole field of patient experience today. Was the patient having a good experience through the whole journey? And there's so many things which determine what is good outcome in healthcare. So if technology improves the outcome, I would say, why not use it? Whether the word dependency is very different. Utilization of technology is different from dependent on technology. And that is a very important differentiation each one of us have to make. Because when that technology is missing, when the current goes off in many of our operation theaters, that's when the true metal of that anesthetist is possibly tested, where he doesn't have a monitor, he doesn't have any other thing, and he runs to his hand, and he should be able to do that, right? So I'm just giving that as an example. Maybe Professor Ravi Shankar is there on that call. We would love to hear some wisdom from our seniors, sir. Anyone else who would like to take a call on that and answer, the dependency on
Younger
technology?
anesthetist Vidya is there.
Yes, Vidya. Vidya, what would you reflect it on that as? How dependent have you been on technology, and how has it changed?
There are two things, like you said, dependence and if just because I have the app on my phone, I decide not to read anything about it, then that is dependency. Like I don't know anything about how to interpret ABG, or I don't know any. I don't bother to learn any of the algorithms for say cannot intubate, cannot oxygenate, or something. Just because I have that app on my phone, then that would be a dependence. But I read it. I have read it. I've tried to understand it, and then I use the algorithm or the app as a cognitive aid. Then that becomes, it is enhancing my efficiency. It's not that I cannot do without it, but it makes my decision making that much more perfect. So no surgeon will now want to open an abdomen without a CT scan. But so will you call it dependence? What would you call it? Like, I could palpate and, percuss and auscultate and make decisions, you can say. But the same surgeon who did all that 30, 40 years ago, today when they have to operate, they will not do it. So I think that is where we are going to come with AI also. That, the sooner we accept that, it is going to help us make quicker and probably better decisions, better for all of us, rather than what Rohini said, trying to, say that, okay, I don't want to have anything to do with it. There's no point being an ostrich. It's already here. Like,
can I come in?
Nalla is the youngest in the group.
Yeah. Let me come in now. I just wanted to say, like, AI is good for learning, teaching, and making it easy for the students to grow up. But let's be very clear, what we have learned from our teachers and the skills is what stays with you. And as an anesthetist, I don't find anywhere where AI can come and make my stress and my thing free. I may have a pulse oximeter, I may have all the technology there, but still, end of the day, if the tube is not into the trachea, the patient is dead, whether it's AI or not AI driven. But what I wanted to say was, all of us have to realize one thing in life: a skill that you develop with touch and feel and passion. And as an anesthetist, it's something very unique. I don't know, surgeons have grown a long way, robotics and laparoscopy and all that. It helps you. All this technology will only assist you. But the basic skill of what you have is what will take you forward. So I just wanted to give you one small example. If I can tell it openly to all of you. Right now, I have cataract, so my vision is very low. So 2 days back, I had to do an LP for a CSF analysis, and I could not. I did the whole LP just with my feel, not with AI, not with technology, nothing. Just feel, and was taught to me by my teachers. So I think AI has got a role to play, no doubt, but the basic skill still stays on. And with the current the way things are going on with medical legal cases, I think everybody has to be very clear in how you use AI and how we can take it forward. I'm sure AI is going to help. AI is going to be a helping tool in the medical field, but it cannot replace the skill and the teaching and the real teaching of a senior person. What I learned from Ravi Shankar is what will stay with me. What I will see from Google and AI cannot replace what my son said. Yeah, what my brother said. What Dr. Ravi Shankar taught me will stay with me. What Vidya taught me will stay with me. Not AI and Google will replace it. Maybe they can only add some mirch masala. That's all.
Yeah,
I just wanted to add it on to the thing.
Yeah, your point is really well taken. We also have Dr. Tushar Chokshi, who is always also an anesthetist, who's always trying to adapt new things and perpetuate new thoughts. And AI is one of his interests. Dr. Tushar, would you like to add something to the discussion today?
From previous speaker, I am deferring that. Suppose if you have failed in your LP, then what is your next steps? So here the AI will help you. So believe me, AI is like an electricity. Whether you accept or not, it will be your part of the life. So in this era, at 60 years of age of my life, after 35 years of experience, I had given more than 50 lectures in AI in healthcare and anesthesia since last 5 years. And I have found that AI is generating me like safe and sound anesthetics. And in our target control anesthesia, to think that a patient will die under anesthesia is a dream. And to dream that part is also a dream. So believe me, AI is your partner in future. You have to accept it. You have to digest it. And without anesthesia, without this AI, the world will not be exist today.
Okay,
Thank you.
so there
Thank
you
you.
have like two ends of the spectrum. So, Dr. Venkatesh, you had some questions and comments. Would you like to come in now, Venkatesh Natarajan?
Ma'am, sorry. Yes, ma'am. I think one of the questions which I wanted to post to the panelists is this. I don't know. I mean, I'm ignorant of this. I've only been recently using some of these applications for complex clinical vignettes and see how it actually responds. And it's been very interesting and sometimes useful. It gives us clear some inputs are really useful for us to explore further. But the question which I wanted to ask is, some of the published literature, especially premier published literature, which is available in many of the journals, are not available to some of the commonly used AI apps such as ChatGPT or DeepSeek. So, are there any specific apps which has access to these papers also? That's one question. And question number two is, as of now, a lot of common people are started using AI for all their medical problems and their questions, and there are too many questions which simply a clinician has to handle. Googling itself was an early problem. Now AI seems to be compounding our misery further. So I'm not sure how that is going to go out in the future.
Yeah, one of the ways the published literature is coming into the AI content database is the companies like Elsevier, for example, or the big publishers themselves are relying on AI and creating their own AI-based front end for questions and answers, and they're creating products by which those peer-reviewed journals become the source of answer. The other way, like OpenAI and Google, what they are doing is they are investing into these companies which actually have the peer-reviewed journals that you mentioned, which are not in open accessibility, and they use the basis of that. So there is a lot of challenge by which content, the data that goes behind content generation is good, but it is improving. That's all we could say. Rohini, any?
Yeah, that's right. And if there's a paywall, then the AI tools cannot access that. The only option is, and that's also one of the problems, is that the areas or universities and schools that have more money and have access to these journals end up kind of, manipulating more because they just have more access and they know more. But yeah, if there's a paywall to any of these research papers, then the AI cannot access it
That's a
either.
very important sort of subconscious word you used, that there is some people have access to it and some do not have access. And that's one of the biggest ethical problem that AI is bringing into the world is inequality. While we were thinking technology will remove the barriers and make access equal, AI has created immense inequality in the world, particularly with the lack of digital access to many parts of the world. And where there is digital access, they don't have access to AI. So one of the challenges, ethical challenges that AI is thrown up is it is bringing in interventions, it's bringing in solutions at a very high cost, at a very high environmental cost, that only the advanced or the richer countries are benefiting from and the rest are not benefiting from. So there is that, again, issue with that ethical problem.
And even like the paid versions of these AI tools, right? You can do a lot more compared to the non-paid versions. And for somebody in the US, maybe it's kind of inexpensive. I'm not sure. I think it's $10 a month for example, ChatGPT. I could be wrong, but it was something in that. But that might not be an option for most of the other parts of the globe. So.
But there are other ways by which AI balances cost in the healthcare. So when we talk of healthcare, we have to have a bit open mind rather than be very narrow-minded clinicians. Healthcare is much more than that patient-doctor interaction. There are a million things happening around that single point of contact that you're having with a patient. That contact is being enabled with. For example, if you look at drug discovery and drug development, which took 10, 12, 15, 25 years, is now going to be, it's already brought down to 1 to 2 years. So if you look at that cost of drug discovery, that is actually coming down considerably by AI. So while on some areas AI does bring in additional costs, there are areas where AI is reducing costs. In the area of diagnostics, for example, AI is trying to bring in a lot of reduction in the cost of reaching a diagnosis. If you look at virtual consultations, for example, that has reduced the cost of so many logistic costs where virtual consultations are reduced. If you look at the UK, just about 5 years back, almost every consultation in primary care had to be face-to-face. Today, 70%, 80% of consultations in a lot of primary care is virtual. So we have to understand how technology brings the benefits and try to leverage on those benefits as much as we can. I will pause here because I'm mindful of the time, Vidya, and I will leave it to you now to take it to conclusion.
I just thought Shilpa could come in. She had a lot of comments. She had even cited some papers. So Shilpa, would you like to add something about the environmental cost of AI or anything else that you wanted to say? Dr. Shilpa?
Yes, ma'am. Hi, ma'am. I placed my comment because it was a large comment, but ma'am had addressed it a little bit earlier. Like when we go forward with AI, and it is inevitable that we should move forward with technology, all the ethical considerations, including the effect on climate change, because it is the biggest threat to human health hanging above our heads in this last century. So how to judiciously balance, learning and new technology along with the cost, like ethical cost and the problem of people trusting generated content, which might have false attribution a lot of times and all that. A lot of it has been addressed already. I just wanted to bring in that question. Thank you.
Environmental impact is a very big challenge, and there are many ways of addressing it now. There are people who are looking at what we call as distributed computing, where they are trying to not just have dedicated servers and all this, but use everyone's computer all over the world as actually effectively servers. But there is no doubt that AI is an energy-hungry industry, and it has created a big problem, particularly in countries where the distribution of that energy is not equal. So it means that only certain certain parts of that country is developing because of the data centers, and the rest of the world country is actually lagging behind that. So a very well made point. It is added on to the problem of environmental degradation. Vivek, sorry, you were trying
I
to
just
say
wanted to add the AI, using AI for the reduction of the cost, especially in the country like Nepal, where I'm from. We have many areas where doctors cannot reach. Like people have never seen a doctor for like 60 or 70 years because we need to walk like 3 or 4 days to reach that place. And AI has dramatically improved the healthcare services in those areas because the paramedics, local paramedics, can communicate with the doctors using technology and digital medium, and the quality of healthcare has dramatically improved. So this can help with the resources mobilization and maybe cost reduction using the AI in the healthcare industry.
Yugender, you had a question at the beginning about AI in clinical practice. Is there any app? Have you narrowed down your question? Because Shivam had asked you to narrow down what is it that you want to use AI for in your clinical practice. So if you have a specific question, please feel free to ask it now. So Manohar Shah, if you're still on the call, would you like to add something? And do any of you want to go back to this question of can AI be used in pathology with minimal investment? I really don't know what the word minimum investment means, but if one of you want to take that question, that will be fine.
I think there was a question on radiology.
Can
we
AI
discussed a lot on things. So, I mean, radiology has been traditionally one of the forefront areas of utilization of AI. And definitely it is being a field where AI is taking over quite a lot of it. And we can say with almost quite a lot of certainty at the evolution of how AI works, that radiology, definitely in diagnostic radiology, quite a lot of it will be taken over by AI. There is no doubt about it. There are many research papers which have been written to say that that is one field, because it's entirely based on computer vision and reasoning, both of which have now been too well developed in the AI field. What would remain is interventional radiology, and there also there is quite a lot which is being used. AI is being used.
So Venkatesh had spoken earlier, but he had asked what are the downsides of using AI apps in solving complex clinical vignettes.
See, the problem with using AI apps is in today's world, as it stands today, much of these AI apps are very siloed answers. They are not going to give you the answer for the entire patient problem or the patient journey. If you're going to use AI apps which are largely diagnostic related, which is where most of the AI apps are there, that's fine. But if AI apps are going to give you ability to get second opinion, for example, or curated opinion through automated literature review, for example, where you have got complex problems, complex decision making, and you want to have as much literature review that could be done within that 15 minutes that you have, there AI definitely comes into use in regular practices. But as it stands today, we all have to accept that definitely human interface in healthcare delivery is definitely far ahead of where AI is. We are not denying that, but definitely the role that AI has to play in complementing or supplementing that human effort and efficiency and decision making is progressively improving and increasing. That's the way to summarize the discussion, rather than say one above the other. We have to be mindful of how rapidly it is growing and how important it is going to become soon in our life, and therefore we learn to embrace it positively rather than negatively.
So Vani has added that in a lighter vein, we were birding from our terrace. The Merlin app picked up calls of bulbul and tailor bird. My husband was whistling, and the app said Himalayan whistling thrush. So there you go, an example of what. So Vani's camera is on. Yes, Vani, you can unmute yourself. Vani, do you want to unmute yourself and speak? No, we can't hear you.
No, we
I
just
will.
have to we just have to
So
compliment
I
how
just want to
well.
say, I just want to say that it was so good. The moderators and speaker, I understood AI. I mean, a bit I understood AI, but I'm like very human. Like just that Himalayan whistling thrush put me off that Merlin ID app. That's it.
No, we have to
That's
compliment
me.
your husband, ma'am. His whistling was good.
Does anyone want to take this question? DeepSeek versus ChatGPT, which is better on a lighter vein?
For now, I think we are not more acquainted with the DeepSeek, so definitely we need to wait for some more months or years to say that which one is better.
So,
No, what DeepSeek has done is DeepSeek has brought a new challenge into the AI industry. We were all thinking that AI takes billions and billions of dollars to develop, but DeepSeek says that we can do it in millions. And that is the biggest challenge that DeepSeek has brought, and a new thinking into the AI industry. So it is revolutionized the AI industry in such a way that hopefully it is democratizing AI. That's the first thing it has done. The second thing DeepSeek has done is to bring AI into open source realm. So it's not anymore that AI is going to be in the hands of few people. AI will become more democratized now. So those are two big advantages DeepSeek has brought.
So I have my schoolmate Vinod Rathi logged in. He's actually an engineer, but he's into a lot of other things. Vinod, you made a lot of comments on the chat box. Would you like to speak up?
Hi.
Hi.
Good evening.
Evening.
It was nice to listen to all these discussions from doctors, and being not a doctor, I was trying to see what are the doctors thinking about AI. And in fact, you have mapped up all the concerns and opportunities very nicely. The only thing what I would say is that it is inevitable and it is here to stay. Use it and try to find out, how you can benefit out of it. Because it's like Bitcoin, whatever governments may do, there is hardly anything regulation can do to stop it. And when it comes to comparing one format with other, like DeepSeek with OpenGI or OpenAI, what finally matters is basically like what is the business model? Because if you look at it, it's not the question, the software which is expensive, because a lot of things are done in open source also. But it's the platform. The platforms are power guzzlers. You need a lot of power, electric power also, and compute power also. And those chips are, not easily available. Handful of, people only manufacture it. Now there is a design cost, and typically West has been, trying to whatever investments they do in R&D, they try to, milk it out, and that's what makes things expensive. Look at what has happened to Intel now. Like it's finally silicon. Once you amortize the design cost, the prices slash like anything. The same thing will happen with this also. And what I anticipate is that more players will come in and they will further drive down the price. We are also developing. India is also developing, silicon for this, and within a couple of years, even our chips also would be available. Now, once that happens, and governments will invest in creating that infrastructure and making it available to startups and small players, you'll see the usage, skyrocketing. The thing is that the people think that artificial intelligence is something new. It is not new. It was there for 35 years back also. All those algorithms which we have for signal processing, whether image enhancement, voice recognition, all those things, those algorithms have been there. The mathematics part of it and algorithm part of it was there 35 years back. The problem was computing capacity was not available. If you had to run those algorithms, then you needed a mainframe computer to solve those, run those programs. Now what has happened is that kind of capacity has come on the desktop. And with the data centers coming up, you can virtualize it also. So what is going to happen is, more and more complex applications, it will be possible to run those applications and, arrive at better decisions. I remember because, 35 years back at IIT Madras, when we were, when I was studying, we had a subject called image signal processing. And in that, we were talking about how to take a photograph and identify what kind of an object it is. And it was a defense application. Identify whether in the night you have a, thermal image, which is coming from a IR camera. And from that, you do filtering. It is noisy, so remove the noise, do the edge detection, and find out what object it is. And this was used by, battle tanks. So that capability was there. I'm talking about 35 years back. And in 35 years, a lot of progress has happened. Now, the place where I think, where we can, India can add a lot of, value to this whole thing is bringing expert knowledge. Because all AI systems need is learning. And the learning is as good as the person who is, supervising it. Because unlike, our digital things, either it is 0 or 1, here a lot of things are subjective. So eventually what I see is that there'll be apps coming up in which they say that, okay, this is a, let us say X-ray image. So someone who's an expert in X-ray image analysis would develop the algorithms. And the coding will be done by a programmer. But how do you interpret an image? That part will have to come from doctors. So then what happens is, if there is someone who's very good at it, his knowledge will be available for people who are less good at it. So then what happens is it becomes an additional tool. So I look at it that it's going to be like that. And it'll democratize, availability of very good consultants to masses. So they talk about bottom of the pyramid, that, okay, when you have large number of people whom you're servicing, if you collect a very small, minuscule amount also from them, it makes business sense. So those who want to use it for business, they will also find, things would be useful. And those who want to do it as a social service also will find opportunities, like how do they deliver this particular service at a lower cost. So these are the aspects which are positives also. So I think, we should, as a country, we should, align in towards this particular thing and create a knowledge IP and monetize it. The way software industry has come up, same thing will happen to this also. You'll suddenly find that, next level of medical services would come from India probably. So those are the opportunities.
On that positive note, we are like really out of time. So Rohini, our closing comments, and I understand you have to leave for a meeting. So your closing comments, Rohini.
No, thank you so much. This has been incredible. And truly what I was hoping is that we have a really rich discussion, and so that I can also learn more from everyone. But I just wanted to say that, echoing what everyone has said, that it's up to us, and the onus is on us to make that collaboration and to see how we can really utilize this new technology that's coming in with all of the changes that it's coming in with, to the best of our abilities, and make it efficient and make it so that there is global use and in healthcare.
So Radhakrishna, your comments.
Yeah, sorry for joining late, but it's a very interesting conversation. I have 2 points to make here, and I want the faculty to respond. Recently, I saw a 14-year-old girl with a pancreatic tumor, which is not so common, and that requires what is called enucleation, where you don't do a major surgery called Whipple's. The father of the patient, I think, is computer savvy. Says, sir, I asked ChatGPT whether this is a possibility. It says no. It didn't mention what treatment you say. He just went off because we have done a similar case in the past. We had two other patients who said who asked ChatGPT that I'm a 64-year-old and this is this drug suitable for me? And ChatGPT comes with 20 possible contraindications. I don't know. I think where is the line drawn here about the ChatGPT which you and me use is the same ChatGPT which patients are using. I don't know whether any of you have faced this, but this is an interesting phenomenon. Shivam, if you can respond to this.
ChatGPT is evolving, Pata, and it has got many versions of it, and it depends on whether you're on a pro version or a non-pro version. But overall, it depends on how you input into the ChatGPT. So basically, if you ask the question, tell me whether enucleation is better than Whipple's, it'll give one answer. Next, if you say, look, I am a 65-year-old man, but I have got this cell type of the cancer and my blood pressure is this and my cardiovascular status is this, wouldn't enucleation be better than Whipple's because of my cardiac status and outcome is going to be better? You get my point? So ChatGPT's response depends on what you input into it. And like Rohini illustrated in her discussion, the best way to use ChatGPT is what you have that ability to input everything in context also. Don't give a generic question, but put the patient Imagine if you took a second opinion, but you would have told maybe Prof. Ananthakrishnan, look, I got this 45-year-old who's diabetic, who's having this and this and this and this, and then only you will ask the question, should I do enucleation? So the way we ask the question to ChatGPT matters.
Yeah. Secondly, a classmate of mine who's an ophthalmologist, and he said is retiring, and he's been a very ardent singer of devotional songs and sort of a religious person. I said, what are you planning? I said, I'm going to learn AI. Now, I said, how are you going to learn AI? See, I'm a surgeon. I've been to open surgery, lab surgery, robotic surgery. I know how to learn it, but how will I learn? And he's confused a bit. Now, how will we learn AI what is the modus operandi? He says there's one course, a US course, which is of 6 weeks. I'm going to pay and learn. We all hear about AI and have some idea, but we don't have any good knowledge like robotic surgery or how to give a lumbar puncture or whatever. Where is the line drawn? How we go about?
It depends what I'll take the answer, and then maybe Vivek could answer. It depends on what you want to learn in AI and why you want to learn AI. But if you want to learn AI for the sake of using it more effectively in your life, then you want to learn for the applications of it. So you look at how best to utilize ChatGPT, or what are the various sources of AI and what are the tools that you can use. On the other hand, if you want to actually say, look, I am a surgeon and I want to actually bring AI into my surgery, and I want to see, I've got 20 years of possibly content in surgery, and I want to use AI to create an IP, for example, then your learning will be very different, where the focus on that would be AI-driven content generation, maybe a course. There are many courses there. So my answer to that is the way you want to learn AI would depend on the objective behind it. And the best news about learning AI is AI itself helps you to learn AI. And that's the beauty of it. If you want to take 20 minutes, go to your ChatGPT and start putting this question. What are the types of AI? Why should I know AI? Tell me 5 uses of AI. Give me the reasons why AI is bad. You will get all the answers there. But the only problem will be textual answers. There are other sites where you will even get the videos and the lectures given to you. That's my sort of take. Vivek, your response to that?
Absolutely, because today we have many universities, top universities, they are coming up with those 6 months course and 3 months, but that may not be feasible for everyone. So the best answer, as Dr. Shivam has told, using the AI to learn the AI, that is the best answer. And probably that starts with using that one party asking the question on what are the different types of AI and going on deeper and deeper. The second part is once we start using the AI, we start knowing what we are going to ask to the AI so that they can answer with more precise, they can give us more precise answer. So that is just using the AI. And once we go on with using the AI, we get some idea. The second part is using asking the AI about different types of AI, or maybe how we are using that. The third part is probably through various videos that are available online, and the last one is taking any courses.
Yeah, actually, in the last couple of months, I should say, the lectures I make are made in 5 minutes time. You type a thing. I want a 20 slide, 5 sentences, bulleted and index whatever. And next question it asks is, you want it? Do you want it in a PowerPoint mode? Believe me, and they're very authentic, very complete. And same with writing chapters in books. Things have become sort of so. I think the intelligent quotient of doctors will slowly come down. Their learning will come down, and there's a very, very sad part of this AI, Shivam.
No, but that's where the challenge Nalla was trying to throw comes into place. See, information, knowledge, wisdom. That's the hierarchy. AI so far has been very good in information. 2, it is now becoming good in knowledge because of its ability to reason. The day it brings in wisdom, that is, it brings in many years of and many views of knowledge and wisdom and application, then yes, we are going to have that challenge. But that is where they are saying anywhere between 10 to 20 to 30 years. But we don't know. It could be 5 years from now.
That probably answers Dr. Kaushik Bhattacharya's question also. As of now, definitely there is going to be someone needs to sign, because as of now, it's the human who's responsible for the decision, right? Even if AI interprets the radiological image, the radiologist has to sign off at this point in time. But yeah, sometime in the future, it may be something else. And then, of course, there is some interesting discussion about use of ECG in predicting ACS.
There was a comment on the role of AI in ECG
robotic signature.
Yeah, there's a
whole will come and sign the consent.
No, there is a whole process. There's a whole industry called robotic process automation. Okay, there is automation where right from generating your report to signing the report is also authorized to the machines. It depends on for what purpose you want to do it. That's all. And the question of legality is where it is. Today we have the legal system says you need a signature. In 5 years or 10 years from now, the legal system will be altered and say, okay, an AI-driven thing is enough. So at that time, the signature will become redundant. So that's the way evolution happens.
This is an AI-generated report and does not require a signature.
Yeah, if the government says that, what prevents it from becoming normal, isn't it? Just because the government is saying today we need a signature, the radiologist is still just putting the signature on a system generator or a machine. Like Patta said, he's used the AI to generate the PPT. He only went and delivered it. Tomorrow he will have a virtual assistant of Patta who will not only generate the teaching but will also deliver the teaching in Chola hotel and possibly get the award and come home.
Vidya, just before you close, I welcome Vivek and his team from Nepal, and this is the first. I think this is the 216th episode where Vivek has joined in. Thanks for coming in, Vivek. I hope you enjoyed the conversation today, and this is what you hear or see in Marvelous Medicine, which Vidya has been running for so long. And thanks for coming.
Thank you, sir. Just I want to add a few points. Like maybe 5 years or 3 years more, maybe 4 years back, I was just following the LGS and whatever Sir is doing along with the team in India. And I thought a similar idea in 2020 when people were having a crisis of hospital management during the COVID second peak. and doctors were not getting the bed. Oxygen were scarcity. There was scarcity of oxygens. So overnight, I created a small name that is NEDOL, Nepalese Doctors Lounge. I wanted to make this name far from the political name or any associations or councils. So this was the name that came up in my mind, and I started a virtual launch. And today we have, in 2.5 years, we have 11,300 doctors. We have conducted several webinars. We have received some of the international awards of whatever we are doing in Nepal. And we have collaborated with councils and associations and international organizations. And one of the inspiration for the NEDOL is LGS. That is the reason that at this point, I just proposed, sir, you are doing these things. Let's collaborate and let's expand this knowledge to even in Nepal, and maybe we can exchange more in the future. So thank you everyone for this interactive and fruitful webinar, and we hope to collaborate in the near future. Thank you so much.
Thanks.
Your closing comment, Shivam.
I think thank you, Vidya, once more for inviting me, and it's always marvelous the discussions that we have in Marvelous Medicine, and Patta, you always bring in that energy, and soon you should start a TV channel, I suppose. So thank you, all of you, and all I want to say is that AI is here to stay, and it's up to us to embrace it in the right direction, and yes, shape it as much as we can before it shapes us.
So I'm happy to tell everyone that exactly 4 weeks from now, Shivam will be talking about AI in surgery. And next week, we plan to have an interesting, a little bit deviation from the norm. So we are going to have a panel discussion of what medical school did not teach me. So we're going to look forward to inputs from different people who started off doing MBBS and then went on to do different things, some teaching, some management, some research. Somebody running their own clinic, somebody running a corporate hospital or working in that. So we are just going to it'll be light-hearted but informative session on which we think will be useful to younger doctors, what you missed out learning in medical school. So thank you everyone, and sorry for exceeding time, but I hope you all enjoyed the discussion. It was an extremely interactive session. We'll meet again next week with another episode of Marvelous Medicine. Till then, take care and stay safe. Good night.